All right. Good morning once again, and thank you for staying tuned to us. So, like I said earlier, the topic for today is economic burden of fake medicines in Africa and solutions to it. So, and I mentioned earlier that we have some seasoned speakers take us through this presentation. So, one of them is Musa. So, Musa is the Assistant Director, Pharmaceutical Service, and the Head of Unit, Skilled Drug Manufacturing and Quality Control Unit, Pharmacy Department, Jos University Teaching Hospital, Jos Plateau. Fam, you're welcome, sir.
Thank you for having me here.
You're welcome, fam. So we'll begin shortly. Just hold on, fam. Also, we have Mr. Pius Alabi call also. He's one of our speakers and he's also one of our own. He's the program manager, RxAcademy for RxAll. He would also be talking to us and giving us some basic information that probably we don't know before we might have known. So we are also glad to have him on call. And the last speaker we have on call is Farm Stephen. Stephen will join us shortly. I don't know if he's on call at the moment, but he's going to join us shortly. So we'll probably just kick off with Farm Musa. I don't know if you're ready for us, Farm.
Yes, I'm ready.
All right, over to you, sir. You have about 15-20 minutes. So take us on.
All right. Good morning, distinguished colleagues, ladies and gentlemen.
Morning,
yes, good morning.
Yes. It's a pleasure having me here to speak on the economic burden of fake medicines in Africa, and then the various solutions that were meant to curtail such an ugly trend. You bear with me that medicines are essential part of the healthcare delivery system. So having fake medicines in circulation is actually very detrimental to our healthcare system, especially in resource-limited settings like Africa. So we'll take it this way. The outline will be, we'll have a background and then the current status of fake medicines in Africa. Then we'll go straight ahead and talk about the economic burden of fake medicines. The burdens will be categorized into three major portions. We'll have the burden on the patient, the burden on the healthcare system, and then the burdens on the economy. And then we'll profile some solutions, then we'll have a summary, and then we'll conclude. First of all, we'll look at, is there any distinction between fake medicines and substandard medicines? Yeah, there's a little distinction between them because substandard medicines are products whose composition and ingredients do not really conform to specification, as in they may have excess amount of active ingredients or less amount of active ingredients, and then they eventually will lead to ineffectiveness on the part of the patients taking these medications. And then usually substandard medicines occur as a result of most instances negligence, and they also have human error, and they also have insufficient human and financial resources, especially, and it could also be as a result of counterfeiting. Whereas fake medicines are medicines that are deliberately and fraudulently labeled, especially with respect to their identity and source. So of course, the major difference is that in terms of substandard medicines, it's as a result of some human error or some technical issues. But in terms of fake, of course, it's an intentional act. It's intentionally, or people that are engaging are fraudulent about it. So you will notice that faking of medicines could apply to both branded and generic products. They could also apply to innovator products and then some other components. Then you also note that in fake medicines, the drugs could have the correct ingredients but fake packaging, others with wrong ingredients, and then there are others without even active ingredient. And then some who also have insufficient and then excess amount of active ingredients. Of course, according to WHO, which is our standard, World Organization, notice that fake medicines may cause harm to the patients that are taking them. And then they could also fail in the treatment of the diseases under which they are intended to cure. And then it also can lead to a loss of confidence in the healthcare delivery system. And then, of course, the loss of confidence in the healthcare professionals administering this care. And then, of course, there are categories of medications that are likely, that have higher tendency of being faked, especially medications that are used in management of very prevalent disease conditions, especially in Africa, like anti-malarials, antibiotics. They're not limited to these ones. Also have some diagnostic equipment and even vaccines. You could also have drugs that are some expensive medications, like drugs in the management of cancer, and then even drugs that are used in management of mild, moderate to severe pain. Because of course, in African setting, these conditions are predominant or prevalent. You also note that fake medicines can be found in the illegal street market. You go to the open drug markets, especially in rural settings, you find them in the open space where they are not regulated. They can also be found in bus parks. And then they are also sold via illegal websites. Of course, you know that the internet generation we are in now, you notice that most instances people access information from fraudulent websites, and then some of these drugs are marketed on such fake websites. And then they can also find their way into pharmacies, they can find their way into clinics, and they can find their way into hospitals where patients consume them to have most of those negative effects. It is also estimated that about 10 to 15% of medicines in circulation worldwide are fake. This figure could be higher in African settings. They go to 30%, and even in some areas, you can have up to 60% of drugs in circulation tend to be fake, especially in the developing countries and resource-limited settings in Africa. And then also note that because of decreased or less access to quality healthcare services in African countries, we notice that it creates an environment for medicines fake medicines to make their way, because the unsuspecting patients will rush to these facilities or to the open market to get medication because they have no other option. And eventually, this medication may turn out to be fake, which will have some effect on their system. So, and of course, you also note that for every $1,000 invested in medicines, criminals may make up to $20,000 profit, especially via trafficking. If you try to compare the cost structure of drug manufacturing, the manufacturing cost takes about 45%. Then we'll have tariff, tax, administration can take up to 10%. Then the wholesale and distribution take up to 50%, while the pharmacy margins, their markup will take up to 30%. That's for genuine medications. But if you note that people that fake these medications, the cut off the manufacturing cost could be as low as 5%, while tariff, tax, administration, they don't pay any of this. They don't pay tariff, they don't pay any tax, and that will be 0% for fake drugs. And they also have wholesaler and distributor percentage, which is 15% for genuine medications, and then 0% for fake medications. And then the pharmacy margin. Of course, most instances, they find these fake medicines find their way to the pharmacies. So they make some kind of 25% profit margin. If you notice it cumulatively, people that engage in fake medicines make a lot of huge profits from these illicit transactions. Then let's go to our topic proper. You're looking at the consequences of fake medicines. Number one, the first one is on the patient. Patient, primary person. Of course, it manifests in the area of adverse drug reactions, and then toxicity, and then poisoning, which may lead to hospitalization, disability, and also lead to death. And then the next we look at on the patient is treatment failure. Of course, you note that patients that take fake medicines and will not get any therapeutic value for the medicines they're taking. And then to also prolong their treatment duration, and then it increase in the cost of diagnosis, and then can also have additional costs of consultation to the patient. And then also have diseases that are being treated, are being managed using these fake medicines, will end up becoming untreated. And then leading to an increase in morbidity and mortality. And then can also have premature death. And then let's look at the problem on the healthcare system. On the healthcare system, there's usually wasted budget on drugs. Budgets that are meant to procure genuine medications will be a waste. And then it can eventually lead to an increase in the overall healthcare budget. It can also lead to, because the increase in overburdening the system, because there will be increased hospitalization and the additional costs on medicines and the additional costs on consultations. And then it will also lead to a lack of confidence in the healthcare system, because the people begin to have negative feelings about our healthcare system. So it increases that. And then it can also lead to a loss of confidence in public institutions as a whole. Of course, people have the mentality that public institutions don't provide the services that are needed. So with the increase in the menace of fake medicines in circulation, people continue to lose confidence in our public institutions. And then let's look at the consequences on the economy. It will result to lost productivity, because of course, personnel that work for government, economy, to develop the economy, will have lost man hours. People will be absent from their places of work. People will lose some years, especially to ailments that are preventable. And then it can also lead to an increase in medical or healthcare expenditure. And then this will also mean that more money, more budgetary allocations will be assigned to the healthcare sector because of the ones that are already lost via fake medications. And then there's also increase in corruption. And then it can also lead to diplomatic problems, especially travel bans from within continents of the world, from Africa and to other continents of the world. And then the crux of the matter is, how do we mitigate this in terms of solution? Solutions can come. The primary thing about solution is education. Education cannot be overemphasized. The first class of people to be educated are the general public. And then the general public should be educated on the need not to purchase drugs from vendors and peddlers. They should also be educated to report any perceived lack of efficacy in any medication that they've procured. It could also need for them to report any incidents of adverse drug reaction resulting from the fake medications they might have ingested. And then more technical, of course, which may be a challenge to us in Africa, is that we should utilize new technology and smart devices that will ascertain the genuineness of any medication that we're about to procure. Then the next form of education is to the government officials. Of course, the government are the policymakers, and then we were able to educate the government on the severity of this perceived problem, and then the risks to pose to the general public. This on the part of the government. Then on the vendors, of course, the vendors should also do, people that peddle or the vendors of fake medicines should be able to be aware of the harm they cause to the society, the harm their business will cause to the society. That's very, very important. So that to be able to, and then most instances, establish rural facilities up to the rural level where governments will have a presence, especially where the citizens can access quality healthcare. And then the other aspect, which has to do with the government, is to also strengthen regulatory oversight, like the strong collaboration between regulatory agencies, Africa and other parts of the world. And then you can also develop technical capabilities for quality testing. Of course, this one Of course, you know the bogus nature of the mini lab in testing medications will be very high. And then the appropriate devices, when you have a handheld device, especially that will give an on-the-spot check on whatever medications that is being imported to the country and whatever medications that is being used in any facility, it will help. And then you can also enact laws, or legislators should enact laws that will criminalize the menace of fake, then punish offenders to serve as deterrent to others. Very, very importantly, on the vendors again, it will not be too good to completely push them out of business, because whether I would like it or not, if patients, citizens do not have access to quality healthcare, there will be no option than to patronize these street vendors. So what do we do to the street vendors? Give them some form of education, and then make sure the government can regulate them also to curtail and then educate them on the dangers of the trade they are going into. And then try once in a while to check out some of the drugs that the market. It will also help in curtailing this menace. Because of course, whether I would like it or not, patients that are desperately in need of healthcare services, especially in rural areas, will still patronize these classes of people, these categories of people. And then it will increase the effects of these fake medicines in the society. Then the other thing is for us to enhance supply chain. Of course, in enhancing supply chain, it will be imperative to minimize the number of supply chains and distributors. Of course, if you are able to monitor how the drugs are moved from the factory to the end user or the retailer in the pharmacies and the clinics, to be able to reduce the menace of fake and adulteration drugs. And then you can also consider some different models of drug distribution. It will also help. And then we can also work with drug manufacturing companies to be able to track the system so that you'll be able to identify medicines that are being faked. And then it will be imperative also to deal only with select suppliers who have proven integrity. In that case, you're able to minimize the incidences of fake and adulterated medicines. Then the last one is we need to have a public-private partnership with some NGOs, as non-governmental organizations, that are into pharmaceutical supply chain management, so that to be able to curtail the incidences of faking of to reduce this, to reduce effect into everyone in our health system. Very much. I would like to conclude by saying that economic burden of fake and substandard medicines is a global challenge, even though it is higher in developing countries, including countries of Africa, which have limited healthcare resources. So the menace is higher in developing countries like Africa. And then efforts at addressing these challenges require very close collaborations between the regulatory agencies, pharmaceutical companies, and then appropriate systems, which should deliberately ensure consistent supply of quality medicines. Thank you very much for this privilege of having to present to this great assembly. Thank you.
Thank you, Fam. We really appreciate your time, and I'm sure we've gained one or two things from the lovely presentation you just rendered. So thank you very much, Famusa. We are grateful. So shortly we'll be going into the next presentation, but we'd just like for you to watch a very short clip from us. So it's just a minute or two. It's more like a testing. Someone is testing the quality of drugs using a technology, Rx scanner. We will get to that later. It's just like a teaser for us. Yeah. So shortly we'll be having Farm Stephen on the call. He'll be taking us through his topic also. Farm Stephen is a pharmacist. He's also a fellow of the Postgraduate College of Pharmacists. He works at the Drug Production and Quality Control Unit of the University of Abuja Teaching Hospital in Gwagwalada. So, and while the other presentation is going on, any questions that we might have at any given time, let's put it in the chat box and then we'll get to it. So at the end of all the presentations, we'll take the questions and the answers. You can also follow us on all our social media handles. It will come up on the screen shortly, and we can always get back to you via that. Also, you can reach us at info@rxall.net. You can reach us at www.rxall.net. So these are our social media handles for us. We're on Facebook at RxAll, LinkedIn at RxAll, Instagram at RxAll_INC, Twitter at RxAll_INC. Then on YouTube, we're also at RxAll_INC. So without wasting further of our time, I would like to invite Farm Stephen to take us on this topic, economic burden of fake medicines in Africa. Over to you, Farm Stephen.
Good morning, Pharmacist Adebayo, Pius, the logistic officer in Nigeria. And then good morning to all my colleagues world over.
Good morning, Farm.
To this presentation this morning. It's a pleasure to be here.
Morning,
Thank
Farmer.
you.
Thank you so much.
Pleasure to be here. Thank you. So for all our listeners across the globe, I want to let us know that the topic is the economic burden of fake medicines in Africa and the solution. And by the way of introduction, substandard and falsified medicines pose significant risk in our global health. Nearly 1 out of every 5 child come down with malaria in middle and low-income countries. So there is a lot of consumption of anti-malaria within the African region. And we have discovered a lot of poor quality drugs among the anti-malaria agents. And this means that a lot of these children will probably die from malaria, not for the lack of treatment of malaria, but for the lack of high quality malaria drugs. There is an increasing demand for medicines, vaccines, and other medical products and devices in almost every country across the globe, and much more in the African region. As my colleague, Pharmacist Musa mentioned earlier, we have poor supply chain management within African countries, let alone this regional control. So when there is a fake drug that has moved into the continent, they find their way very easily across all borders to the end consumers. Also, we have found problem with the fast growing electronic commerce, the e-commerce. The growth of e-commerce also has created opportunities for falsified medicines to be introduced into the supply chain system. And also, it is important to note that the presence of the substandard and falsified medicine products in countries and they are used by patients has threatened to undermine the Sustainable Development Goals of the United Nations. Some of these products, as mentioned by my colleague earlier, have poor quality, they are unsafe, and threaten the health of the users. The problem of substandard and falsified products continue to increase as globalized manufacturing and distribution system grow ever more complex in our time. The complexity heightens the risk of production error. Production error is higher in this time than ever before because of the demand for large quantity of medicines across the globe. I've heard of a particular automation machine that can produce 10,000 batches, 10,000 bottles of liquid products in 1 hour, 10,000 pieces in 1 hour. So if there is an error in that batch, it means there will be error in 10,000 bottles and 10,000 patients will be at risk. The complexity has heightened the risk of production error, as I mentioned earlier. Then increasing demand for medicines, vaccines, and other medical products is also a risk. So it is important to also note that reliable data on fake medicines are scarce. There is no nation that comes up with a unit or a department that go on to research to say, okay, this is the information we have on fake drugs within the year. We have pockets of researches going on, but not an elaborate nationwide research. We also have lack of scientific data on the burden of fake drugs. We have lack of understanding by policymakers. Policymakers are decision makers. And where they don't have clear understanding of the public health and economic costs of fake drugs and substandard medicines, this will lead to poor investment in regulatory agencies and poor investment in quality control laboratories and poor investment in quality control equipment. This has brought us to statistics. What are the statistics that have led to what we are discussing? Substandard and falsified anti-malaria has contributed significantly to malaria burden in Nigeria, Ghana, Burundi, Tunisia, African countries, and many African countries. 1% of the anti-malaria of medicines in Nigeria, according to United Nations research, WHO research, the WHO research in 2009 reveals that 14.1% of the drugs in circulation are substandard or falsified. This strongly agreed with the 15% that my colleague mentioned earlier. And this means that for every 14% of these falsified drugs in circulation, we have 33,300 admissions and about 12,300 deaths. If our government can rise up to the task and remove all this, then we'll have fewer admissions and we'll have fewer deaths. The total economic burden of malaria leads to the loss of about $648 million of a lifetime productivity index per year and about 400 million short-term productivity index. What this means is the gross domestic product for such country will drop by that amount, and removing $650 million for from your gross domestic product, you know what that means to the productivity of such nation. The total big burden of malaria cannot be underestimated. The maternal death rate in a country like Ghana, a middle-income country, the maternal death is between 17% to 22%. This is actually rather too high. But this has been linked to the presence of substandard urotonic drugs like oxytocin and egometrine and misoprostol have been found to have falsified and under low quality products within the market. We also have what we call frank poisoning within in circulation some time ago in Nigeria. Between 2008 and 2009, 84 children died from poisoned teething syrup, which was, instead of glycerin, they were given diethyl glycol, which led to kidney failure and the death of about 84 children before it was discovered. Similarly, in 2007, in Panama, the same diethylene glycol was supplied in place of glycerin, and a lot of patients, not less than 219 patients, died from kidney failure. Having said this, I would like to define some terms. You will hear all used interchangeably: substandard drugs, falsified drugs, unregistered drugs. To clear for cleansing, I will define these terms. Substandard drugs, which are also called out-of-specification drugs, are authorized medical products that fail to meet either the quality standard or their specification, or both specification, British Pharmacopoeia specification or United States Pharmacopoeia. We have unregistered or unlicensed medical products. These are actually, they can be registered in some other nations, but when they don't have registration in the region where they are being sold, they are called unregistered products. And such products are not permitted to be sold in that region. So every product must be registered in the region that is being sold to avoid falsification. Then we have falsified medical products. And falsified medical products are products that deliberately or fraudulently represent their identity and composition for the purpose of money making. For instance, some people can go and put paracetamol, ACT, lumefantrine, artesunate. That combination, it's expensive. And they could just put paracetamol, which brings down malaria fever, which brings down fever in malaria. And the patient might be thinking it's working, but before you know, there will be a strong rebound of malaria. So because of all this, it is good to have understanding on how these terms are being used as we progress. It is important to note at this point that there was an analysis that was carried out, a multinational analysis carried out by WHO, I think around 2007, 2008, 2009. And from analysis, various testing devices were used to run the check. We had mini lab, we had high liquid performance chromatography, other chemical tests, spectrometer, and in all, on the average, we found about 14% of those drugs to be substandard, and that is the revelation. The therapeutic category ranges from analgesics, pain reliever, which are commonly falsified, and anti-malaria, antibiotics, antihypertensive, antidiabetics, tuberculosis drugs, HIV drugs were also included among the products that were falsified. So in other words, it means that these people who are into doing fake medicines try to make money across the board. What is the impact? My colleague had done justice to the impact on substandard medicines. I'll just try to run through them quickly. We have impact on health. Number one, the adverse effects, the toxicity from incorrect active ingredients. It's very dangerous. It can lead to end organ damage. It can also lead to death. It leads to increase in the number of days of hospitalization and the number of days of out of work of the patient. The failure to cure or prevent future disease leads to increase in mortality and morbidity. and therefore there will be prevalence of disease. Imagine faking vaccine. That's leading to a future explosion of such disease that the vaccine was supposed to prevent. We have progression of antimicrobial resistance and drug resistance infection coming on because of fake medicines. We have loss of confidence in healthcare professionals and health programs and the health system at all if we allow fake medicines to prevail in the society. Economic impacts. Increase out of pocket and health system spending on healthcare. The money that is meant for school fees will now have to be used for healthcare because of substandard products. Because when you buy fake augmentin, for instance, and you try to use it to treat typhoid as prescribed for doctor and it didn't work, you still have to go and buy another one. So it's a lot of economic burden on patients, families, and the health system. And it's also a large economic burden on the manufacturers because they have to spend larger amount of money to trace the fake drug in the markets. Waste of human efforts and financial outlay across the health system further strains resources, staff, and infrastructure. Increased burden for healthcare professionals, national medicine regulatory authorities, law enforcement agents, and the criminal justice system that will have to bring to law all the people that violate these government regulatory policies. So socioeconomic impacts. What are the socioeconomic impact of substandard and falsified medicines? Number one, lost income due to prolonged illness, death may occur eventually, loss of productivity costs to patients, households when seeking additional medical care, and the effect of which are felt by businesses and the wider economy. We have lack of social mobility and increased poverty in our system. So what are the action points for the management of fake medicines and the proliferations? Number one, identification of factors that drive the emergence of substandard and falsified medicines and medical products in Africa. We have to identify what are the things that drive people into producing fake medicines. And once those have been identified, then the government can begin to get to the roots of all those to uproot them. Then we have recommendations for health authorities to detect and deal with substandard and falsified medical products along the distribution chain and also at the consumer level. Saying here, there is a need for the government to be able for this purpose. Also, the government has to develop national action plan to prevent, detect, and respond to substandard and falsified medicine products by policymakers. However, it's important to note that there is a need to create global regulatory focal points of network among nations. If a drug is being faked in, let's say, Cameroon, we should be able to intercept its entry into Nigeria. And when we do that, we break the chain of supply. So when there is a collaboration among nations, we can break the network of supply of fake and falsified medicines. Then implementing a tracking and tracing system from manufacturers to endpoint consumers. There must be a tracking and tracing system. Where there is a need to recall a particular batch, the company will be able to, through tracing and tracking system, to recall all the products that are suspected to be substandard as a result of manufacturing error. Also, understanding authentication technology, it's very, very important to conscientize patients for healthcare products to be able to confirm the quality of their drugs. Like the scratch method, that authentication number sitting at the back of drugs, the patient should always make sure they use those authentication number to check the quality of these products, so that the patient also will be responsible for themselves. In conclusion, it is well recognized that investing in public health generates cost-effective health outcome and contributes to wider stable economics for the consumer of health products. It is important to state at this point that policymakers to be brought to the center of regulatory issues, so that from time to time, policies and laws that pertains to regulation can be strengthened per time, because these people are moving with technology. They are moving with the information technology, so that laws can be used to mitigate new areas that are opening up for them to strengthen their falsification and substandard business. Global surveillance and monitoring system as developed by WHO for substandard and falsified medicine products should be strengthened. And this will provide the impetus to make a compelling case to mainstreaming the prevention and detection and response to substandard and falsified medical products as a goodbye for health development in Africa. So thank you for listening, and God bless you. But before I conclude, I would like to say that we have various types of testing devices. We have the mini lab, which is quite expensive. We have the chromatography technology. We have the spectrometry technology, and we have the normal laboratory technology. All these technologies I have mentioned are very, very expensive. More recently, we have the RxAcademy technology, which is not as expensive as all these. It can be a very first-hand technology that we can use to test drugs within our community, within our region, and we'll get first-hand information about the quality of the drug before we can use them. So as we make efforts to put all this on board, engaging the lawmakers, I think we'll be on the right track to having a safe environment. Thank you.
Thank you very much, Fam. We really appreciate the lecture you've given us. It's very straightforward, simple, and we digested it quite well. So along the line, we had some question which will be dealt with shortly. So we can all emphasize the importance of the testing treatment and method you just mentioned. And also the previous ones we've had are expensive and not easily accessible to the layman on the street or a community mass. It's very important for us to know that very technology and they are successful transfer get results automatically, and we'll talk more about that from the next speaker. So without further ado, I would like to invite Pius Alabi. Pius Alabi is the product manager for RxAcademy, representing RxAll International. So Mr. Pius, you have the floor.
All right. Thank you so much, Olushe Yolari. Thank you so much, Fan Steven. That was a very beautiful presentation, and it was impactful on the fake medicine in Africa. So my name is Alabi Pius. I'm the product manager for RxAcademy. So I'll begin here by introducing what RxAll stands for and what RxAll is, why we have or who we have. So RxAll, we are a social impact company that is seeking to save lives from falsified and substandard drugs by empowering or working with the local FDA, the regulators, the pharmacies, and hospitals to secure the drug supply chain. We are also a drug checking technology company. We provide a proprietary AI platform, nanoscanner, which is our main product, and with a mobile app to test quality of drugs across the world. So we also enable pharmacies and hospital patients in Africa to buy high quality drugs, non-counterfeit and online. So in order to secure the supply chain through our online platform. So this is what we do at RxAll, and this is how we impact the society we are. So, and here are the founders of RxAll. On the first on the list here is from Adebayo Alunge, the CEO and the founder. So it's our own. And we have also Amikao, who is the Chief Medical and Marketing Officer and also the co-founder. And we also have Liu, that's the Chief Technical Officer and also a co-founder of RxAll. So inventing a device that will enable citizens of the world to confirm the quality of any drug. This was an impressive device, and in the recent year, we won so many awards. So we have just listed a few of them here. And the common one here, let me put it that way. Most popular one here is the Hello Tomorrow award, which we actually won out of 195 startup companies across the world. So we emerged as the best, and this actually put us to the whole wide world. So let me begin by adding more to what our speaker said earlier on the substandard. Substandard drug is not just about the anti-malaria or other OTC drugs. So we also have anti-substandard drugs in the prescription, in the opioid, cannabis, and narcotics. So all these have become a globalized production in the world, and also ready distribution through the internet make it easier for people to have access to these substandard drugs. And it's very difficult to curtail or control because it's getting higher almost every day. So although we can't take out the importance of centralized lab for the drug testing to confirm the quality of any drug, but we should also consider that the FDAs, the pharmacies, and the hospital need more analytical device in the field, in the warehouse where we have all these drugs stored, and also at the border where the movement of these drugs take place mostly day to day, and also in the hospital and the pharmacy where the end user mostly gets this drug from. So it is therefore more important to decentralize the drug checking to the hospital and pharmacy, because these are the people, the closer center to the end user, where the end user can easily get all these drugs, and also allowing them to use a device, an analytical device like RxAcademy, to enable them know the quality of drugs before dispensing to their various clients or patients. So what do we offer? The solution we offer to this economic burden of fake drugs in Africa, and also the solution we have to it is by providing an AI technology which bring down the percentage of the substandard drugs in the circulation to the very minimal lowest. So we have provided RxAcademy platform, which is an AI blockchain platform that helps the local FDA, hospitals, pharmacies to check the quality of a drug or chemical ingredient using their mobile phones, and also an handheld RxAcademy. So all this happens, this testing happens in less than 20 seconds in 4 steps. And here are the steps. The first step is for you to scan the physical drugs. Here we are not dealing with the label, we are not dealing with the scratch or what is written on the label. We actually go for the content of the drug itself. So how sure are we about the content, what is written on the pack? That is, if what is written on the pack is the same as what is inside the pack, that is the drug itself. So this is what we go for. We scan the drug itself. So this happens in less than 20 seconds. The first step, scan the drugs. The second step is the drug spectra is being sent into the phone app, to the cloud through the phone app. Then our AI analyzes this drug spectra and compare with the sample reference we have processed already in the cloud. Then lastly, the AI will send it back to your phone. Send the result back to your phone, telling you if what you actually have with you is the original as details on the pack, or maybe something else is being put inside. So with this, you are able to see what you are about to consume. And this will give you, we give our pharmacy and the hospitals and the FDA a kind of assurance to secure the supply chain, because if the pharmacies, the hospital have this knowledge about the fake or substandard drug right before dispensing to their patient or their clients, so it will really secure our supply chain, and we have more standard drugs in circulation. So the FDA, hospital, pharmacies need a faster and more affordable alternative to tedious work in order to assess quality of a new drug they procure. So the solution we provide is different from the existing commonly used drug quality check we have available today. At RSO, we offer a value for what you paid for, much better than what is available in the market today. So RxAcademy platform is a very portable nano scanner that is robust for use in the HS condition. That is, no matter where you are, no matter, you can use our technology at any point in time, because it is so portable that you can just put it in your pocket wherever you go, in a pharmacy, in an open market, hospital. You can request for a quality check before you pay for whatever medication you're about to get. And also for the pharmacies, for the hospital, this will enable them to give assurance to their clients that whatever they are seeing on their shelf is being confirmed before putting them on the shelf. So RxAcademy platform is cheap. It's cheaper than the existing mini labs and other drug testing device we have in circulation. RxAcademy platform enable access to real-time testing from any test location. Local FDA inspectors can also securely prepare and send reports to their superior and teammates using the RxAcademy platform. So wherever they carry out these tests, they don't have to collect samples, transport the sample to their lab before they can actually give reports of what a drug is. Right from the point of testing, they can actually see if what they are having is a substandard fake drug. And this report can be sent to their colleagues on that same spot. So RxAcademy platform helps drug regulators, hospitals, and pharmacies also to quickly check the quality of the drug in less than 20 seconds, as explained earlier, using their mobile phone at any place or time. So as a result, the RxAcademy platform outperformed the existing drug testing device, our most important requirement by the users. So the next slide here, we try to do a comparison between the some of the existing devices used for drug checking and also RxAcademy. So as mentioned earlier by Stephen, that's our last speaker, we provided a device that is so cheap, affordable to everybody, when in terms of operation, and in terms of size and time of results. So let's try to look at some of these existing devices. So the first one I have here is the bench Raman spectroscope. This requires a lab technician to operate any others, or maybe solvent or reagent to prepare the sample. So it is not portable, it is always stationed in a lab. And when we are looking at the cost, this cost is between, let's say $30,000 US and $50,000 US. So which is far make our solution more cheaper. When we are trying to compare this with bench Raman spectroscope. So another one is also portable Raman spectroscope, which is also a portable device for drug checking. But here it requires an expert to operate this. It requires an expert to operate this. You don't need to get any reagent to prepare the sample. It is small as well, but not as small as RxAcademy, because this always comes in a suitcase, and most of the time it's stationed in the lab as well. So the results and the time of result is fast. In some minutes, you have the results to you, and also the cost. This is above $50,000 US before you can get this or have this in your lab. So the other one here is liquid gas chromatography. This is very difficult to operate. So we need experts, more experts to operate this, and it requires additional expendable. To prepare the sample, you need to get some solvent, and this is not movable. It is always stationed in the lab. And the result also is very slow. It will take between 24 hours to 72 hours or more to get the results. So this is not giving the users the requirement they requested, and make it difficult for them to make a quick decision. So, and when we talk about the cost of this, it's always on high. This is always on high. So the next one here is the mini lab. it requires a lab technician to operate. You need reagent to prepare the samples. Although it's small, also comes in suitcase. The result is also fast. In minutes, you get the result, and the cost is between 30 and 50,000 US dollars. So, and the next one here is fluorescence and spectroscopy, which also require a lab technician. You need software for that also. Station in a lab. The time of result is very slow. It takes some days before the result is out, and also the cost. And when you look at all these existing drug checking device compared to RX, so for RX scanner, you don't need a technician or an expert to operate this machine. Just a basic information on the usage of this scanner, you are good to go. Anybody can use the device to confirm the quality of any drug. You don't need to expend any further expendable supplies to carry out the samples, and it's very portable. Just size of your palm, just put it in your palm. You can put it in your pocket, move around with this, and do your drug checking at any time, any place. And the result is so fast. In less than 20 seconds, the full process of confirming the quality of this drug take place in less than 20 seconds, and the cost is very low. So here we talk about the affordable and the price of RX scanner. So it is affordable, and it's on subscription base. So you see that you subscribe monthly or yearly to use the software. And the application, the mobile application is free. You can have this downloaded through your Google Play Store. It's free of charge. So we can also build a customized database for maybe government institutions, private hospital, pharmacy. We are open to customize database. So what you need to do is just to choose a subscription plan, either monthly or yearly. And the yearly monthly subscription is at $100, which is about 50,000 naira equivalent to use the so this comes with discount of 20% actually. So when you compare the subscription price of RX using RX scanner to the cost of acquiring this other being the cheapest in town when it comes to price. So now we are more cheaper than the existing counterfeit detection solutions. We are 5 times more portable than any existing drug checking device. We identify incoming raw material and finished drugs. So it is not just, the device is also capable of identifying the chemical used in preparing all these drugs. And the solution can scan either tablets, powder form or liquid form. So we are able to do this, and we allow for non-destructive drug identification. So for the regulators that require more analytical information, the platform is able to store the record of scans carried out at any point, and this is accessible to you. You can also carry out this. So all these are the benefits which put RX scanner ahead of other or existing drug checking device we have around. So in conclusion here, what RSO is trying to do here is that we should decentralize the drug checking to the FDA inspectors on the field, to the pharmacies and hospitals. This will greatly reduce the substandard and counterfeit drugs and chemical in Africa. So over-reliance of drug checking in a central lab is making it a little bit difficult for the FDA to actually cut or reduce this the high percentage of falsified or substandard drugs in our society. So we need more analytical devices like RxScanner to be all over the place, that at the checkpoint of the local FDA in every hospital and in all the pharmacies. Let there be check and quality check on every drug before dispensing to the public. So as a result, done by the regulatory inspectors and pharmacy are available immediately. So like I said, I explained this earlier. So for the FDA inspector, they don't have to collect the samples from the open market, transport to the lab before they can actually make a decision on the suspected substandard drug in circulation. So they can easily do this with RxScanner platform. Wherever they are, they send the report immediately to their superior and also colleagues, so that people can be aware of what is happening and where these fake drugs are and who are the supplier of this fake drug. So finally, decentralizing drug quality check to hospital pharmacies will enable them have real-time information about the batches of bad drugs in the country, and won't have to wait for a periodic survey by the FDA in order to record this drug. So the moment an inspector from the FDA, local FDA, send out a report on the substandard drug, it is all over. Other inspectors will be aware of this, and the information will pass across to everybody that, hey, we discover this batch to be substandard of any particular drug, and immediately the FDA can make recall of this batch. This will stop and also help bringing down the percentage of falsified or substandard drug in our society. So here I conclude. So for more information on how to procure RxScanner, or you need more information about the scanner, you can reach us on this. You can get through to us on the information you are getting here. So you call our number, either you make the direct call or WhatsApp call. You can also send us an email at sales on this beautiful device. We would love to hear your feedback on this. So thank you so much, Sam Musa from the University of Just Teaching Hospital, and thank you so much from Stephen from and it has been a very wonderful presentation. So thank you to you all our listeners, and Shay, take over here from here.
Yeah. All right, thank you, Mr. Fayos. That was a nice presentation about the RxScanner. Don't forget that you can connect with us on social media. We're on Facebook, LinkedIn, Instagram, Twitter, and of course, we have a YouTube page also that you can actually check some of our videos there. The video of the RxScanner that you just viewed a while ago is also on the YouTube. You can always check it on YouTube. So we had a couple of questions along the line. I think I'll direct the first question to either of our speaker, but I think it was when Stephen was making his presentation that the question came up. So Igbomo was asking, well, what are we doing about sensitization to the public of the public? You know, when you talked about where to start, when you were talking about the solutions, you mentioned sensitization, that we need to let people be aware of the implications What have we done with the general public?
Okay, I actually spoke about sensitization on the general public not to procure medicines from vendors and street peddlers. That's the first thing. Secondly, that in the event that you suspect any efficacy of any medicines you purchase, immediately report to the necessary authority about the lack of efficacy of any medication. And then, of course, as I said earlier in the lecture, I said one of the consequences is that there's increase in adverse drug reactions. And if there's any adverse drug reactions that is noticed, should be reported. And we know most instances we have from pharmacovigilance and drug safety centers in most of our teaching hospitals, coordinated by NAFDAC. So this should be reported. Relevant it is, especially any adverse drug reactions. Thank you very much.
Yes, thank you, Stephen. I hope that clarifies the question. So we have, I just want to appreciate some of our listeners. We have Fam Oloyede from Oshogbo. We have Fam Mohammed, is a representative of NAFDAC. And before I even continue that, he left a little note for us. So he mentioned WHO already how any falsified products are reported, and the information is automatically made available to all countries in the world. So the focal point for Nigeria for this information is domiciled in NAFDAC. So that's a kind of good information for us. And also he said that it's called WHO Rapid Alert System. So it's about good information for us. Thank you, Fam Mohammed from NAFDAC. He's reaching us all the way from Kano. So we also have Fam Blessing, Fam Ayorinde, of course, Fam Sound. We have Fam Ayuba, and we also have our very good client from Jos. We also have Well-Being Pharmaceutical on the call, and all other members and other participants. We have Mary from the state government. So someone asking that how can we think about the cost implication of scanner? So just a minute, let me look for the question.
Scanner is to make an intention. You can reach out to us via our email. So you will get a link where you need to fill a form to show the interest in the scanner. So when you fill this form, you take it up from there. So the cost of this RX scanner, it is on subscription base. For a month subscription, you need to pay $100 or Naira equivalent. And for yearly subscription, it's $1,200 US dollar. You will get a discount of 20% off. So you are ending up paying $960 US dollar or Naira equivalent. So when this payment is confirmed, we are giving you, that is the RS scan itself. It will be installed in your family or hospital until the end of the subscription. So that is the cost implication of RS. And we also give you train, and our support is 24/7.
Okay. All right. There's another question. Is someone is asking from Dahiru, is the RS scanner is applicable, whether it can be used in PHC facilities across Nigeria? That's across the country.
Oh yes, it can. It can be used at any facility. So what you need to do is just show interest in the scanner. We'll get it across to you after the payment is confirmed. And we also train with the scanner. So the train is free and the is free. You can get it and use it at any facility. Yeah.
Thank you very much, Mr. Pius. I don't know if anybody has another question before wrap up, although we are way behind schedule, but okay, I think we'll just leave it at that. And thank you very much. I want to appreciate our guest speakers, from Stephen, all the way from Abuja, University of Abuja Teaching Hospital in Gwagwalada. We also would like to appreciate Famusa. Famusa is reaching us from Jos. He's the Assistant Director of the Pharmaceutical Services, and he's also the head of unit Small Scale Drug Manufacturing and Quality Control Unit, Pharmacy Department, Jos University Teaching Hospital. Thank you for your time. And I also want to appreciate all of us and for the time they've spared to be a part of this program. So we appreciate you all. So without further ado, I would just like to thank everybody I thank you all for attending very impactful by our guest speakers and also from our in-house speaker, Mr. Pius. And I'll also implore you to reach out to us at sales@rxall.net. That's our email address if you have any further inquiries to make. You can also call the number 090-99479. Also on the chat box, you can see it there. So that will be our webinar session for today. So before, I also like to mention to you that we'll reach out to our members at the end of the presentation. If you have any other thing, we'll create an avenue where you can reach out to us. That will be all from us today. So let's be on the lookout for our next topic that will be coming up in April. So we'll also send you the invitation for those webinar session and due to. So thank you all. My name is Lucia from RX. Have a great day.
So much, and thank you.
All right.